We had an active participation. Like, for instance, there were 100 points of connection. Here it's 370 points of connection. We have about 10,000 participants in this conference, and this is a very large auditorium. Of course, there are difficulties, but the doctors, the medical workers, and not only in Moscow but in other cities, can actively participate in this international cooperation. And we start our conference, and I give floor to Dr.Dzukaev. Thank you very much, all of you. And of course, we understand that my role has been exaggerated, of course, and we are just doing our work. What I wanted to say is that we right now in our hall there are a lot of people who are online on their computers, but also in our clinic we have a lot of participants, active participants of our conference. Allow me to introduce the colleagues, or probably you'll do it. First of all, I would like to greet Dr. Milancia from Portugal. He is one of the leading specialists in Europe. And of course, you'll have questions. Also, we'll have, I see that there is a lot of attention. And by the way, he looks upset because he's not in an OR, because he spends most of his life in Kurgan, in the famous center of Yelizarov. This is Sergei Olegovich Rebich, Professor Rebich, because he's not in the OR, but he has to be with us today because he needs to tell us about the complex surgeries. This clinic is on the rebound.
So first of all, I would like to thank you very much for the opportunity to participate in this innovating meeting. And I will go a bit back to basics. Considering that most of our spine surgery is still fusion surgery.
I'm from the Burdenko Hospital, a neurosurgeon. What I'm interested in is that when you were treating the purulent process, how did you stabilize the process? Without the vertebra? Yes. The patient was in bed and immovable because there was no, we couldn't stabilize it immediately. There was no, there was ventral epidural, and the patient had bacteremia, and we could only have the complex treatment. We have moved to the subject matter of the pathological osteoporosis. I have changed the name of my presentation. I want to say that it's really very difficult to choose, to select the approach. From 2002 and to 2014, the number of spinal patients in Moscow, 1/3 of all the surgeries is spinal. 500 surgeries are on the spine. Of course, we operate better, diagnosis is better. I read somewhere that in Japan, the population has over 10 million people aged over 80. Hypodynamic style of life, especially in women, and that's why we get more and more patients like that. As dietologists, they all need, this is Oktoberfest, and that's why the beer. Thank you very much for your attention. Thank you, Andrei. You were asking lots of questions about protection. You never mentioned your shielding. Sergey, do you have any? Do you have protective glasses? Yes, I do. And the apron, 0.5, and we started using protective glasses, I think, when we have percutaneous technologies. I think we've been using them for a year. But I'm not in favor of percutaneous technologies. That's why I try to run away from from the radiation. And in conclusion, I wanted to say thanks to all the participants of our conference. It's a very unusual conference. Of course, the idea was to make it interactive, fully interactive, because we are all somehow in the web. We have internet connections, but without that live understanding that we are present here, shaking hands, feeling the stage, because we are taking the group photo.